Thank you so much to all of our presenters here in the room. And now we are going to move to Stella Fogleman, who is presenting remotely from LA County. Stella, we can see your slides in the room, so please go ahead.
Excellent. Hi, everybody. Thank you so much. I'm glad to be there in voice and in spirit. I'm sorry that I can't be there physically, especially I just wanted to give a quick hello and shout out to Dr. David Eisenman and Chip Schreiber, who I worked with here in LA County. And I don't know, had I known, Suzette, that you were going to be our moderator, I might have made extra effort to change things around. But I'm going to give you the best that I can from here from LA. I have remote access, but it doesn't seem to be, I can move my cursor around, but I don't seem to be able to move forward. So if you could just go ahead and move forward for me. Okay, thank you so much. So we've heard from wonderful colleagues. Dr. Palmieri, thank you. Mission accomplished. I do care, and now I'm very frightened. But I know I saw a lot of dots here in LA County, so I'm thankful for the burn centers here, and I know we have a lot of work to do in further coordination. As you see on your agenda, I am the Director of the Emergency Preparedness and Response Division for the LA County Department of Public Health. This is a little bit of a breakdown of our LA County operational area. And what I'd like to do for you for the next 10 minutes or so that I have is give you insight as to what happens in public health departments in a fire response and in some recovery efforts. This is our jurisdiction. We are 4,000 square miles strong. We have 88 cities. That includes the city of Los Angeles. We are the health department for 86 of those cities. The cities of Long Beach and Pasadena have their own health department, local health departments, but LA County is then the health department for the rest of those 86 cities. That's 10.2 million residents, 45 million visitors, adding on top of that each year. We have over 200 languages spoken, and then we have 100 hospitals, and then we have a mix of law enforcement and fire agencies. They either have their own city municipality police and or fire, or they contract with the county sheriff's department. 80 plus school districts. We can go on and on. The bottom line is it's extremely challenging for the vast area that we cover, the people that we're responsible for protecting, and the different agencies that have to work together to do an effective response, effective preparedness, and then working together in recovery as well. If you could please advance one more. My division specifically, we sit within the County Department of Public Health. We work with our partner agencies to assess and prioritize our threats and hazards. We do that every 5 years. We do a hazard vulnerability assessment looking specifically at medical and health hazards and matching that against our resources and the damaging effects it would have on our population, and then we reprioritize our threats. We just did one last year, and no surprise that heat and extreme heat and wildfires coupled together rose to the very top of our priorities. We take those priorities and we develop collaborative emergency and disaster plans with our partner response agencies and community partners. Partnership is the key when you cover such a vast area. You have so many partners to work with. You know, we do all year round. We're working with partners, planning, doing exercises, looking at different scenarios and working together, building our capacity to communicate, notify one another, and work together. We develop educational resources and do community outreach efforts to build community preparedness and resilience. And Dr. Schreiber was a big part of building the Psych First Aid and looking at our psychological, the response for disasters a few years ago with our LA County Disaster Resilience Project. We also provide training to our own staff. We have 4,000 staff in the Department of Public Health alone, and we conduct drills and exercises together across the departments of our various divisions. We must maintain 24-hour readiness to respond to emergencies and coordinate the rest of our department in conjunction with response with our fellow agencies here in LA County. And then the majority of my division is funded by the CDC Public Health Emergency Preparedness Cooperative Agreement, but then we also attain additional grant funding, and we manage that for the department. And then we conduct and coordinate our regular public health emergency responses. Next slide, please. This is just one of my staff, Pablo Valadez, and he is responding out to the Woolsey fire here in this photo. This is our emergency response vehicle. So it may look like just your regular first responder, but next slide. Just want to highlight for you the difference between public health and our traditional first responders, or what we uniquely contribute to the first response table, what we bring. So our day-to-day is our preparedness. That's what I do. But we reach back to a lot of different resources, a lot of data, a lot of public health implementation of programs. You'll see the diversity and the breadth that which we cover for our population on a day-to-day basis. So looking at environmental health, looking at occupational health and safety, looking at wellness, looking at health promotion and injury prevention, in addition to all the things that we do, that's just pointed directly at responding to an emergency, whether it be an environmental emergency, a natural disaster, or a bioterrorism event, or a pandemic disease. There's a lot that we bring to the table. Next slide, please. Some of the unique elements are the data that we can bring, the evidence base that we can also bring to informing our response efforts, in our preparedness, and then in our recovery. And then looking at the way that we work with communities. We are a strong presence out in communities, and we do a lot of efforts to look at working with the different languages, the different cultures that make up the fabric of our communities on a day-to-day basis. So with that understanding, we can help provide the rest of our fellow responders with additional layers to our response. So that used to be when we were first to the scene of a public health or of a first response, around the table with our other first responders. It kind of seemed like we took a long time to make decisions. It kind of seemed like we were sort of a little bit slower. It didn't have as much of the resources. We've built that part of our response back up, and now the strength is that the knowledge and the expertise that we can add to the response activities. Next slide, please. Okay, so one of the resources that we have within the health department is our policy group. In LA County, that is comprised of our director, our health officer, and our chief medical officer. And then depending on the hazard or the threat, what we're responding to, it could be our environmental health director. It could be other communicable disease experts that we bring. So they're often the first to know. My staff will roll out to the scene, try to gather some situational awareness, and then we plug right back in to our leadership and our decision makers at the department. They help us set the goals and provide our strategic direction. We authorize our missions, and then they're often the face of the response. So once we have those marching orders from them, the rest of our field staff can mobilize, the rest of our missions can mobilize, and then when we have public-facing press events, messaging that we put out, we try to stay consistent with the folks who are speaking to the public so that they have the reassurance of knowing, starting to get to know and familiarize themselves with our health officer, with our director, so that they can feel a stronger connection to us. Next slide, please. As I was mentioning, my staff will roll out and be the first on scene. They are eyes on. They will go to the command post. We've built that capacity over the years to be able to respond 24 hours. If we do have to issue health officer orders, if something like quarantine or isolation is an order, we can bring the folks to the response scene to issue those orders if necessary. And then we reach back and provide our organization and coordination for the rest of the tactical responses that need to come through, and we direct the ICS mission. Next, please. So that brings me to the Woolsey fire. The Woolsey fire started on November 8th last year, and it went on till November 21st is when it was declared officially out. It impacted a lot of communities within that area in Los Angeles County. One real impact that I wanted to highlight for you all is, if you remember the Borderline bar shooting in Thousand Oaks, that was just the night before on November 7th. And some of the survivors of that Thousand Oaks borderline bar shooting had to evacuate their homes because of the Woolsey fire or had to help with evacuation efforts. So when we think about the psychological impacts to communities, that was one that was really, that just stands out as one that was, really devastating. This was a large and devastating fire. It burned almost 97,000 acres. This is roughly the size of the city of Denver. And then you can see the structures and homes that it destroyed and damaged. There were 3 firefighters injured. There were 3 residents killed. And as Dr. Palmieri mentioned before, there were 295,000 people evacuated, and it cut power to almost 40,000 people. A lot of the residences, in the hills, the oceanside, hillside communities, you think about those are well-resourced folks. And that's sort of an image, but that's not always the case. And then there are also folks that are more hidden populations that were strongly impacted by the loss of these households. We also want to make sure we're thinking about people who lost their jobs, people who lost, who were childcare, housekeepers, groundkeepers of some of those larger homes and more well-resourced homes, but then across the board, not focusing just on the Malibu mansions that were a part of this, but the effects on the overall population. Next slide, please. So going back to the first day, we got the notification of a fire in Ventura County, which we know is a neighboring county. That alerts us to make sure that we're leaning forward and getting ready. We anticipated that the fire would come into LA County, and then as soon as we heard that it was in that direction, we deployed to the command post and briefed our policy group, as I mentioned and described before, that that we were going to have to stand up our emergency management structure. Next slide, please. So for our initial fire coordination, that is a picture of one of my staff there around the table at the command post. We are looking at fire. One of my colleagues on the panel was talking about smoke contamination and the air quality in the surrounding areas. We're looking at as people are able to, as the fire is shrinking back and people are starting to be able to move back into areas that had some burn, looking at contaminated debris and how to handle that. For those who are sheltered, looking at their sheltering, looking at sheltering patients, our shelter operations. Of course, we want to make sure where we are moving people to are safe. So we're looking at food safety, food handling, disease control, sewage systems, and making sure all of that is safe and the environment there is safe. And then, of course, notifying the public about what is happening, what health protective measures that we want them to do. There are a lot of questions about masks. There are a lot of questions about whether or not people should close down schools or play outside or be outside. So we try to, as quickly and effectively, concisely as possible, start to get out our messaging on our website, on our social media, engaging really closely with media to try and get our messages out there before, other people start jumping on. So that's a huge aspect of our public health response, is really trying to get our messaging as simple and as hearable, as accessible to people as possible and getting out there. There are also small water systems in some of these remote locations where fires, a lot of these wildfires occur. There are smaller water systems that are not part of the large municipalities, and so that can get easily damaged. So we have to make sure that people are getting safe water. Next slide, please. This is a long one, my next one. Can you guys still hear me? Hello. Okay. So this is a list of our objectives, and I'm not going to read through each of these for you, but I just want you all to know that, like I said, with our policy group and our leadership, the very beginning of our response, we try to be as comprehensive and efficient and effective as possible. So we try to capture our marching orders in these objectives. Again, when you think about if public health has 4,000 employees, there are lots of teams and there are lots of field folks that will take that, you know, it has to trickle down and be communicated to our folks who are on the field looking at different mission areas. So we try to, from the top all the way down, look at and organize ourselves into these objectives. So you can review those on your own, but we do our best to try and capture what our mission is going forward. Next slide, please. Hello?
Yes, Stella, go ahead. We can hear you.
Oh, yes, next slide, please. If you could switch to the next slide.
Stella, are you able to see the slides advancing?
No, I'm still stuck on the Woolsey fire objectives on my, and that might be,
okay.
That just might be my.
So why don't we move toward a summary at this time so that we can get to some audience questions?
Absolutely. So I think I'll just go all the way to the end. It is my time. You all can look at the different responses, the different actions that we had. We had a lot of key actions, and public health was a central role in pulling a lot of health and human services in the recovery efforts. We still have a lot of work to do in improving our response and improving our work coordinating with our fellow agencies. And you know, it's at the top of our list for our priorities. So there's still lots of whole community planning efforts working with our fellow agencies and with the communities that we serve on a day-to-day basis to continue to improve our response capacity and in working in recovery. So that's the gist of it. You all have the text from my slides. Sorry for that technical difficulty at the end. And thank you very much.
Thank you.